Culture impacts how we see the world. It informs how we organize our societies, our perception of space. If you are going to be a future provider, and just understand in terms of people, like their either aversion to nearness or their preference for being distant, sometimes this is not a signal that they don't want to engage with you, but maybe this is cultural. Time orientation. And one just sort of perception of space. My beloved colleague here, Rabbi Holtzman, over the years of working with him in this particular work, to understand as a member of the Orthodox community that I cannot shake his hand. And so that we have figured out ways in which we culturally connect with each other without breaking that particular taboo of touching or shaking each other's hands. Time orientation, the image to your right is this funny clock of African time, and this is something that I learned when I was in the field, that time is relative. To say just now could be 5 minutes, or it could be 3 hours later. And so people's understanding of when to come, or their sense of time orientation, can also be impacted by culture. Communication practices, which I'll talk a little bit more about, and then, of course, biological variation. Culture informs beliefs about sickness and disease. It can, unfortunately, delay engagement in care and treatment. It can also contribute to non-adherence or misinformation about adherence, drug interactions, and conflicting medicines. I want to just say I understand that this slide shows a lot of the negative aspects, but of course culture also helps us to make sense of sickness and disease. And for millennia, this is how communities around the world have been able to interpret and understand horrific events, plagues, etc. It's through the lens of culture in terms of managing and coping with sickness and disease. So culture and communication, which I mentioned before, is very, very important. If anyone has ever had an cross-cultural moment and realized the disconnects that happen often when you're trying to communicate with someone, you might think that you're using the same language, but that doesn't necessarily mean that everyone understands what is being said in the same way. So I love this quote. I know you believe you understand what you think I said, but I'm not sure you realize that what you heard is not what I meant. So it's really, really important for you to understand that in our communication system, just because we might be using the same language doesn't necessarily mean that what I'm saying to you, that you're understanding exactly what I'm saying as I wanted you to understand it. And that's just a limitation of culture and language. Cultures also have particular standards for communication. For example, speech volume. Some communities might be very soft-spoken and never, ever raise their voice. Some communities might talk very, very fast or sometimes slow. Some communities might use silence. This is something that I struggle with because my husband, who's not from this country, often will stop and think before he says something. And it took me a while to understand that he's using silence to signal that he's thinking about something. Attentiveness, response time, turn-taking patterns in terms of how we communicate to each other and listening, pausing, listening. Some people might not necessarily respect turn-taking. And then embedded within language, wonderful things are different ways in which we might also speak to our older adults. For example, in Japanese, honorifics, or here in the United States, unfortunately, something known as elder speak, which is not nice. It can be demeaning and put older adults off. And elder speak is, exaggerating your intonation, talking really loud, almost sort of talking down to an older adult as if they're not able to understand your normal cadence of speaking. There are lots of different communicative styles. Some people are expressive, some people are accommodating, some people might seem like they're competing, and some might seem like they're checking out and avoiding. These are different communicative styles, which unfortunately I don't have a lot of time to go into right now, but these all drive what could possibly be barriers in helping our patients as well as working within an interprofessional diverse team. Then finally, there are some negative impacts of language. On the right, you will see a gentleman wearing an absolutely offensive T-shirt, and believe it or not, he was actually at a polling place in Mississippi wearing that awful T-shirt. And then there at the bottom is an image of an all-black surgical team or medical team trying to save the life of a Klan member, which really inspires me in terms of the work that we can do in medicine to recognize that they showed up to do their job that day. So, yes, there are going to be unacceptable symbols that we might have to encounter, Confederate flags, swastikas, etc., that might be off-putting. There's also language, and we need to be really mindful of language. For example, you people, what do you mean by you people? Or language that diminishes people, like by calling someone who is a grown adult a boy. And finally, I just wanted to say that there are, in medicine and in healthcare, there's really no space and place for humor, to making jokes. And unfortunately, there have been lots of instances recently in terms of health professionals being fired because they release TikTok videos making fun of patients. Humor is just not cross-cultural, and it's something that we really, really need to not have in our workspace. This is a video, and I'm going to play this video, and this is a video that I hope that you will enjoy. This is a scene from Grey's Anatomy that is broken up into different segments. And this video, to me, highlights the real importance of cultural competence or incompetence and humility within a clinical context.
Ms. Chu, we're going to push on a PCA pump, give you some morphine, which should help control the pain.
Thank you.
Okay. But there's a greater problem here. I've just taken a look at your MRI.
Anna! Why didn't you call us before coming down here?
Sorry. These are my parents.
What's going on?
I was just about to explain that Anna's MRI has shown that she has a myxopapillary ependymoma. It's a tumor in her spinal canal. But the good news is that we can operate. You have a 95% chance of fully recovering if we get you in this surgery as soon as possible. We can't wait another moment. With a tumor this aggressive, even waiting another day puts you at risk for permanent paralysis.
Father?
No. No surgery.
Mr. Chu, without surgery, Anna will be paralyzed probably within the next 24 hours.
There'll be no surgery today. We're taking her home.
Anna needs the surgery.
And she can have it at another time.
Look, Mr. Chu,
We are taking our daughter home.
Anna, you're over 18. You don't need your father's consent.
I'm Meng and my father is the elder. If he says I go home, I go home.
Meng? Let's find out what that means. Contact social services, see if we can get somebody down here, talk to him.
Do I continue to process? You'll have to sign an AMA form stating that you're leaving against medical advice. Fine. I know this is new and confusing. I called a social worker and she's willing to come down and talk to you.
Spare me the white girl cultural divide love. I grew up down the street from here. I play in a band. I went to UW. I get it. But my father doesn't. He says no. It's no.
We're talking about your ability to ever walk again.
That's what you're talking about. I'm talking about my family. Have you ever even heard of the Hmong people? Our religion has got rules that are way old and way set in stone and way spiritual, and you don't mess with them. You don't anger the ancestors. Even if you pierce your tongue and play in a band.
What are the rules exactly?
Anna needs to have her soul intact before she has surgery. She needs a shaman.
You could have told me that.
Why? So you could call me a fool?
I respect that you have traditions that I can't understand. But you're standing beside me in a $3,000 suit, so I also know that you respect the fact that I'm telling you Anna needs a surgery in the next 24 hours if she's going to continue to walk. She can't leave this hospital.
She can't undergo surgery without her soul. She'd die.
All right, then. We're just going to have to get a shaman. Today. In the hospital.
Shaman's unlisted in the yellow pages. Our shaman is 500 miles from here. You are an arrogant man.
No. I'm just a guy with access to a helicopter. Thank you.
Finding her soul won't be easy.
Never is.
The healing ritual. Are you okay with that?
I can't find my soul if I'm medicated. No pain, no gain, right?
Well, it's not just for your father. You believe it too, right?
I know it sounds like a load of crap, but watch the ritual, you'll see.
See what?
The moment it happens. I'm ready.
Okay, just to quickly sort of process that video. Normally we're face to face and talking about this, but I hope that you enjoyed that video. That video to me highlights a clear moment where one individual was not as culturally humble or competent in their ability to try to figure out what's going on. There were some mistakes made in terms of not asking particular questions. Another provider then does ask the question in terms of tell me more. It's one thing in a part of your training is to learn how to ask these critical questions, especially when you don't understand why people are making choices, the choices that they are, to ask them to explain, to help me understand. There's a lot of arrogance, a lot of assumptions, and I found that I think this TV series was set in California. The Hmong community is a huge, huge community in California, and the fact that the doctor had no idea anything about this community, I thought was also a huge red flag. I hope you enjoyed that video. I hope that you will watch it again and just think about what you can learn and glean from that video about cultural humility and cultural competence.